So in Hodgkin lymphoma, so what we've learned so far in aggressive B-cell lymphomas like Hodgkin lymphoma, diffuse large B-cell lymphoma, is that these circulating tumor DNA assays actually perform very similarly. In other words, these are diseases that in most cases, the tumor cells aren't circulating in the bloodstream. So if you want to know things like whether or not the disease is still present, you have to look for cell-free DNA or circulating tumor DNA. So that's really critical in these diseases like Hodgkin lymphoma, where the goal is to cure the patient. So you have to eradicate all the disease to cure the patient. So what we've learned so far with these assays in Hodgkin lymphoma is it tracks very well with tumor burden at the beginning. It also is true that early changes to the point where you can't detect it anymore are highly prognostic. So that tells us patients that are very likely to get a cure. And conversely, it tells us patients who may not be on the way to cure. So that's important to learn at the beginning. In Hodgkin lymphoma, we still cure a lot of our patients, but not everyone's cured. So we don't yet use this to change therapy, but what it could be used for is to either escalate therapy in patients who you think are not doing well, or what's also critical in Hodgkin lymphoma is we are worried about the long-term toxicities. So we can envision a day in which we actually give less chemotherapy or combination therapy to actually achieve the cure. That's the goal of these types of assays.